First is, the several I'm going to talk to initially emanate directly out of the Office of Financial Board of Health. One focuses on cervical cancer, specifically the increased incidence of cervical cancer among Latina immigrants. And this is a cooperative venture with San Diego State University, our own sexually transmitted disease branch, ProSalud, which is an entity for the Baja California, and Planned Parenthood, specifically to educate the public about the risks of cervical cancer and encourage more cervical cancer Pap screening. So that's one project we're working on. The other one focuses, another one focuses on queso fresco. You're aware that this is a cheese made of unpasteurized milk, and a lot of folks aren't aware of the possible health risks associated with the queso fresco. So this is a collaborative with our Office of Border Health, California Department of Food and Ag, and other agencies to educate the public about the possible danger and actually to consider an operation at the ports of entry to establish a personal use limit on queso fresco. A third one has to do with lead poisoning, and specifically continuing to educate the public about the potential risk of exposing to lead because of traditional pottery. We think a lot about paint in homes and other risks, but so this is a project. Once again, multiple collaborators, California and Arizona through their binational health commission offices, the Food and Drug Administration, Centers for Disease Control, U.S. Environmental Protection Agency, New Mexico Department of Public Health, Texas Department of Public Health, our own childhood lead poisoning prevention program, and the Universidad Autónoma de Baja California. Once again, focusing on educating people about the risks of lead poisoning from pottery. And then finally, we're talking about focusing on pesticide illness. A lot of lack of education about the risks of pesticide illness. And this is once again a collaborative funded by the U.S. Environmental Protection Agency, primarily looking at surveillance, training healthcare providers to be able to recognize the symptoms of pesticide illness as a result of exposure, but also, once again, to educate the public about that risk. And this is a collaboration with Cali, PA, the Department of Pesticide Regulation specifically, the Imperial County Public Health Department, Imperial County Agricultural Commissioner, Comité Cívico de Valle from Imperial Valley, and our own occupational health branch. Finally, we wanted to just mention that the Office of Financial Border Health puts out an annual report, and we will be soon reporting on other health conditions of concern, specifically focusing on maternal and child health, the whole birthing process, as well as various chronic diseases, including obesity and diabetes. The second thing that the Office of Financial Border Health oversees our activities involving the U.S.-Mexico Border Health Commission. And a number of upcoming events that we're collaborating through the Commission has to do with, later this month, there's a National Infant Immunization Week, and we're collaborating that with a Vaccination Week of the Americas on the south of the border to promote childhood immunization. And we're working very closely with our partners south of the border, the Health Ministry in Baja California, Dr. Bustamante, and myself would actually be part of that event. In July, we're sponsoring the second annual Binational Border Health Research Forum, in which research scientists, specifically in the health area, are being brought together to share experiences. So there'll be scientists from both Mexico and from the United States and California pulling together. It's going to be held up in La Jolla, California. La Jolla. And also wanted to emphasize our efforts to sort of reactivate and re-energize the binational border health planning councils. These have been councils that have, to some extent, have gone into dormancy, but what are really key local efforts or by state efforts to feed ideas up to consideration of the U.S.-Mexico Border Health Commission. So we think that reactivating those planning councils will begin to feed more ideas, grassroots ideas, up to for consideration. And then finally, another program that's overseen by the Office of Financial Border Health is the EWIDS program. It's the Early Warning Infectious Disease Surveillance Program. It's a specially funded project to look at ways of cooperating across the border to identify emerging infections like pandemic influenza. So we are working very closely with funding from the Centers for Disease Control, and we're developing, for example, infectious disease reporting protocols across the border with our partners in south of the border. And we are also working through that same process to look at other types of protocols, for example, sharing laboratory resources, laboratory data, etc. So there's a lot of activity about developing better collaborations and cooperations between the states on each side of the border in looking at evaluating and being able to monitor and evaluate the extent of communicable disease outbreaks. So that completes my report. Just wanted to give you sort of a flavor of the various types of health issues that we're dealing with here, primarily under the leadership of the Office of Financial Border Health.
Thank you so much.
You're welcome.
No, I think we have that good job.
Thank you for joining us. Thank you very much. I just want to, I think that concludes our updates. So, yes,
Dr. Horton's, Dr. Horton's department just does a huge spectrum of things that are pretty exciting. You just seen this last week on their arena of prevention and wellness, which gets into your diet and eating good healthy foods. They had a wonderful event in the Capitol that highlighted the fact that if you can eat healthily and stay, even though economic times are tough, there's plenty of places where you can try and eat a good healthy diet. They actually had one of the celebrity chefs come and cook a very healthy type of a breakfast for and a lunch, basically breakfast, I guess, in the morning. And they did a very good job of also highlighting the fact that if you have, in California we're blessed, that you have a great agricultural sector in and around, going back to that food shed, how good it is to support your local farmers markets and the growers within that area. And with that demand, it helps keep them in business and helps drive then a healthier potential for a healthier eating pattern. And I know so much of prevention and wellness is driven by those two things, exercise and a good, great diet. And it was just wonderful to be able to watch how that's moving across the country, but it's really been pushed a lot as well, whether it's at the schools or in your own homes. So these are good opportunities going back to where we would love to see ourselves go in the future, and the partnership then works quite well.
Good. Thanks. If I can just put a footnote on that. Another focus of that event through the ARRA, the Recovery Act resources that are coming, there will be additional food stamp resources as well as WIC, the Supplemental Nutrition Program for Women, Infants, and Children. And the partnership between ourselves and Food and Ag and Department of Social Services is to ensure that as those resources become available, that we also have a very strong message on how to use those resources appropriately and make healthy choices with those resources. And that should have a strong impact down here in along the border region too. Thanks.
yeah.
Quickly, I don't want the theme of that to get lost. I appreciate Secretary Karamura mentioning our event, but the theme of the event that Tyler Florence cooked out was "Eat Right When Money's Tight." So we have some fabulous little posters. If any of you guys would love them in your office, yep, very visual, very directive. The posters quite helpful. So anyway, thank you, and we can get you posters of that if you would like.
Yes.
I had a question. Erica with the Manuel Perez office. Dr. Horton, you mentioned additional resources from the Recovery Act. Do you know there's additional resources for school nutrition programs, maybe summer school nutrition programs?
I don't know specifically whether there are. A lot of those programs go directly from the U.S. Department of Agriculture to Department of Education, and of course, maybe somebody else in the room knows more about. My guess is yes, but I'm not sure. I don't know to what extent there's additional resources.
There is for